According to the Centers for Disease Control, breast cancer has more new cases than any other type of cancer. 1 in every 8 women will develop breast cancer in her lifetime. Although it is not as common among men, it is estimated that 2,620 men will be diagnosed with breast cancer in 2020. However, this is a small number compared to the estimated 276,480 women that will be diagnosed. In this presentation, we're going to go over what breast cancer is, the symptoms, diagnosis information, different stages of cancer, treatment options, risk factors, and prevention for breast cancer. Breast cancer develops when abnormal cells in the breast grow too fast. This could be from old cells not dying when they should, or new cells being produced when they are not needed. There are several types of breast cancers, but according to the CDC, the 2 most common types are invasive ductal carcinoma, which is IDC, and invasive lobular carcinoma, which is ILC. These are both invasive types of breast cancer that can spread to other body parts. The difference is that one is found in the ducts of the breast and the other is found in the lobules. As with other types of cancer, there are 4 stages of breast cancer that determine how large the tumor is and how far it has spread from the original site. Most women know to look for lumps in their breasts, but did you know to also check your armpit? There can be breast tissue present in the armpit or axillary area, so it's important to check there as well. While checking for lumps, also be sure to check for thickening or swelling. Another symptom is irritation or dimpling of the skin on your breast. Make sure to check the nipple and areola area for any abnormalities as well. Look for redness or flaky skin on the nipple and breast. If the nipple is pulling in or retracting, painful, or having any discharge other than milk, which is known as lactorrhea, which would include blood, these could be signs of breast cancer. Any change in the breast size or shape, or any mastodynia, which is breast pain, at all should be examined by a healthcare professional. Men and women will both experience the same symptoms of breast cancer, so men need to look out for these signs as well. There are a few methods of diagnosing breast cancer. Most common is the mammogram. Women over the age of 40 should get an annual exam, which is called a screening mammogram. This is a type of x-ray that will show any abnormalities in the breast tissue. If there's a spot of concern, they will proceed to doing a diagnostic mammogram. This is just a more detailed type of mammogram. There is also a breast ultrasound, which uses sound waves to create a picture of the inside of the breast, which can also be called a sonogram. Ultrasounds are good for examining superficial lumps that are felt, but a mammogram can show more accurate reading of deeper breast tissue. Another type of imaging that can be done is magnetic resonance imaging, also known as an MRI. An MRI is performed by a radiologist and can provide a detailed picture of the inside of the breast by using a magnet that is linked to a computer. The last way to diagnose breast cancer is by a biopsy, which can be abbreviated BX. This is where the tissue or fluid is removed from a suspicious part of the breast and sent to a lab where it is examined under a microscope by a pathologist. The American Cancer Society explains that doctors use a tool called TNM staging system to help stage a patient's breast cancer. The T stands for tumor, where they first look at the size and location of the tumor. The N stands for lymph node, and they examine the size of the lymph nodes around the location of the cancer. Last, the M stands for metastasis. Metastasis means the cancer has spread, so the doctors are determining if the cancer has metastasized, and if so, how far it has spread in the body. The beginning stage is stage 0, and this is called carcinoma in situ, which means the cancer is in its original place. This is the type of cancer found with early detection and is highly treatable according to the National Breast Cancer Foundation. Stage 1 is the next stage, which is also very early. Stage 2 is breast cancer when it has grown, but still in the original location and is not spread past the surrounding lymph nodes. Stage 3 is when the cancer has spread beyond the immediate region and may have invaded lymph nodes, but not distant organs. The last and worst stage of cancer is stage 4. This stage of cancer is uncurable and means that the cancer has spread all over the body to organs including the brain, bones, lungs, and liver. Treatment options may help the patient to live longer, but the main focus is quality of life for a stage 4 breast cancer patient. There are several different treatments available for breast cancer, and most doctors will recommend doing a combination of 2 or more methods. These treatments include radiation therapy, or RT, surgery, which can be abbreviated to SX, chemotherapy, which can be abbreviated to CT, hormone therapy, and biotherapy. Radiation uses high energy wave to destroy cancer cells or slow the growth of existing cancer cells. Radiation is a targeted approach that is used in a localized area, most often after a surgery where a lump was removed. Surgeries for breast cancer include partial mastectomy, radical mastectomy, lumpectomy, and a reconstruction surgery, also known as mammoplasty. Chemotherapy is another treatment option that is an infusion of chemical drugs to destroy or shrink cancer cells. Unlike radiation being a targeted approach, chemotherapy is a systemic approach that sends the medication into the bloodstream, which travels all throughout the body. Hormone therapy is a treatment option that blocks the cancerous cells from getting the hormones they need to grow. The last type of treatment is called biotherapy or immunotherapy, which works with your body's immune system to fight off the cancer. The Centers for Disease Control and Prevention have a full list of risk factors for breast cancer. Living a healthy lifestyle can greatly reduce our risk for breast cancer. This includes being physically active and staying away from smoking and drinking. Men and women that are overweight, especially women that are obese after menopause, are at a greater risk than those of a healthy weight. Taking different types of hormones for over 5 years can increase the risk of breast cancer. Older men and women's risk increases since most diagnoses are women over the age of 50. Genetic mutations or biomarkers such as BRCA1 and BRCA2, having dense breasts, personal history of breast cancer or breast diseases such as fibrocystic breast disease, family history of breast or ovarian cancer, and previous treatment with radiation. A woman's reproductive history can also impact her risk for breast cancer. This includes having your first child after the age of 30, not breastfeeding, or never having a full-term pregnancy. Also, a young girl that has a menarche age under 12 or is going into menopause after age of 55 can increase a woman's risk for breast cancer. Some factors that focus on risks for men are Klinefelter syndrome, where they have an extra X chromosome, liver disease, such as cirrhosis, can raise their estrogen levels, and conditions that affect the testicles will increase risk as well. Hopefully, this report has been informative and is eye-opening for you as it was for me. Early detection is critical for survival, so knowing all of this information as well as the signs and symptoms can help spread awareness and possibly save a life. After all, October is Breast Cancer Awareness Month, so encourage a friend, family member, or loved one to do a breast self-examination or get the appropriate health maintenance screening for their age by their doctor.